Our honors project is on the genetically inherited blood condition von Willebrand disease. This disease causes the blood to clot incorrectly due to the lack of von Willebrand protein factors in the blood. Without this factor, platelets will not stick together the way that they should.
There are 3 different types of von Willebrand, all ranging in severity, types 1, 2, and 3. Type 1 is characterized as mild, where the individual has lowered levels of von Willebrand factor, and is the most common in that 85% of individuals diagnosed have type 1.
Type 2 is characterized by normal levels of von Willebrand factor, but they do not work in the way that they should. There are 4 subgroups of type 2, depending on the specific mutations, but for this project, we will stick with the broad label of type 2 von Willebrand disease.
Type 3 is the rarest form of the disease, in which only 3% of those diagnosed have this type. This is because type 3 is characterized by having very little to no von Willebrand factor in the blood at all. This is the hardest type to treat and the most genetically complex form of von Willebrand disease.
Symptoms of von Willebrand disease include heavy nosebleeds, easy bruising, abnormal bleeding after procedures such as dental work or surgeries, and in women, heavy menstrual bleeding.
Von Willebrand disease is easy to diagnose and identify through simple blood tests. A healthcare professional can check the levels of von Willebrand factor in the blood, and depending on the quantity of the factor found, the individual is diagnosed with one of the types of the disease. In type 1 and type 2 individuals, the disease is inherited in an autosomal dominant manner. This means that the individual with the disease only needs one copy of the dominant gene to phenotypically show the disorder.
In type 3, the disease is inherited in an autosomal recessive pattern. This means that the individual affected must have 2 copies of the recessive allele to phenotypically express the disease.
Although these methods of inheritance lead to a phenotypic expression of the disease, the gene has variable expressivity and incomplete dominance, meaning that the level that the gene is phenotypically expressed varies greatly from person to person.
You can see that we have 2 parents. One is affected by von Willebrand disease and has the genotype big A, little a, and the other is unaffected and has the genotype little a, little a. These parents have a 50% chance of having a child affected by either type 1 or type 2 von Willebrand disease. There can also be 2 affected parents who are both heterozygous dominant for the gene. They would have a 75% chance of passing down the gene to their child. Finally, we can have a scenario where we have 2 homozygous dominant individuals having a child. They would have a 100% chance of passing down this gene to their offspring. Here you can see that we have a few scenarios on how one can inherit von Willebrand type 3. The first scenario can be seen with 2 carrier parents, both with heterozygous genotypes. This means that they carry the defective allele but do not phenotypically show the disease. This gives them a 25% chance of passing type 3 down to their offspring. Another case could be that we have a carrier parent and one affected parent. This would give a 50% chance of the offspring inheriting the disease. The final scenario can be with 2 affected parents. This would give them a 100% chance of passing down the affected gene to their offspring.
Now we're going to talk about the mutations on the von Willebrand gene. Studies have shown that von Willebrand type 3 is most commonly caused by a nonsense mutation, while type 2 is caused by a missense mutation. Type 1 is still being researched, however it's difficult to determine the correct mutation pattern due to variable expressivity and incomplete dominance effects.
Here we have an example of a missense mutation. A missense mutation is a type of point mutation where a single nucleotide is changed, resulting in the translation of an unintended amino acid. This occurs later in the coding region on the von Willebrand gene, allowing for normal von Willebrand factor levels. However, it impacts the functionality of the protein sequencing. In this example, the adenine is switched out for a guanine, causing the transcription of arginine rather than the intended lysine. This is an example of a nonsense mutation. A nonsense mutation is also a point mutation. However, instead of causing the translation of an unintended amino acid, it forms a stop codon, which completely stops protein production. This occurs earlier in the coding region of the von Willebrand gene, causing a short, incomplete protein. The premature stoppage of transcription restricts the production of the von Willebrand factor, making it so that the affected individual does not have clotting abilities in their blood. In this example, adenine is changed to uracil, which codes for the translation to stop rather than the intended translation of lysine. Luckily, there are a multitude of treatment options for those affected by this disease, with pharmaceuticals being the primary care method. Drugs that are common include alphanate, which is a clotting factor used for when those with type 1 and 2 are undergoing invasive surgeries, Humate P, which is used in adult patients with either hemophilia A or von Willebrand type 3 due to its ability to prevent excessive bleeding. And finally, Stymate, which is a nasal spray used by those with type 1 when they are experiencing a large gash or cut.
Gene therapies and genetic transfer studies are currently being conducted to try and provide alternative treatment options. During one of these studies, mice were injected with a von Willebrand type 3 gene transfer to test the effectiveness of the gene therapy alpha-1 and antitrypsin promoter. It was found that the mice saw improved clotting within the first week of therapy. However, type 3 symptoms were again present in the days following until another therapy session was conducted. Also, technologies such as CRISPR-Cas9, along with the therapy options, could allow for more efficient and longer-lasting treatment options in the future.